Thank you very much, Bongiwe, for your time here on ENC. Now, I believe that you have managed to remove a slab that had collapsed so that police can start with their forensic investigations about the cause of the fire.
We have propped up that slab so that we are able to, and good morning, Masego, and to your viewers, so that the team can also go in and complete the investigations that are required, and to also remind the viewers that it's not just us who are doing the investigation. The South African Police Service also need to do their own investigation as part of the whole process.
Now, there's also the importance of air quality before people are able to get in. I assume because the Charlotte Maxeke Academic Hospital is not only important for South Africa, it's also important for the rest of the continent, that you would try to at least partially resume some services while that wing of the hospital is being repaired. How are we going to make sure that there's no air pollution and that it's safe? And how are we going to squeeze everybody in who can't, for instance, access oncology, which is very close to where the incident happened?
I cannot speak on behalf of the Department of Health, but I know for a fact that there are oncology patients that have been taken to other hospitals, including as far as Steve Biko in Tshwane. 1, 2, we are making sure that the air quality is of optimum level by making sure that the ducts that are in the HVAC where the smoke would have gone in are being cleaned, and that the engineers also make sure that they do the necessary tests to ensure that the air quality in those ducts is restored back to the normal levels.
I know that your department's role is just to make sure, for instance, that you help the role players in terms of making sure that it would be safe at some point for people to use the hospital again. Is the plan to probably reopen some services at part of the hospital that wasn't affected, perhaps, once you've made sure that air pollution is sorted?
Yes, definitely. The air ducts and the air quality are at the moment of a high priority to us, to ensure that even those areas that were not physically affected by the fire are done a proper check, and that we are then allowing the hospital to take back the facility and slowly get the patients back into the facility that they had been using for healthcare.
Now, I'm sure you've heard throughout the course of the week some nursing unions saying that, there were no proper health and safety protocols observed at the hospital, that maintenance, which is your department's responsibility, was not done properly. We've spoken to nurses who, for instance, say they're too scared to go back to the hospital because they're not sure if their lives are going to be in danger, especially because this is not the first time that we see something like this. In 2017, there was a structural collapse at Charlotte Maxeke.
I need to remind the very same organization that the issue of occupation health and safety is not the sole responsibility of the Department of Infrastructure Development. In every building, every employer has a responsibility to ensure that occupational health and safety measures, guidelines, regulations, and the legislation itself are adhered to all the time. And this means that it is a collaborative effort between ourselves as the Department of Infrastructure Development under Section 16.1 through our HOD, who then ensures that all the facilities that we are in charge of, we do the legislative maintenance thereof. Number 2, there are also responsibilities of the very same health facilities themselves to ensure that they do have their own OHS team in place, and that OHS committee needs to report any defects, any risks, and any issues. Then those issues are then reported back to us, and then we do the maintenance. But there are also maintenance issues that have to be dealt with by the facility itself. So we cannot, as a department, take the sole responsibility when the Act is very clear and the regulations are clear. And these are also part, of course, of the Labour Relations Act, making it, or rather, requiring every employer to ensure that every building, every facility is of sound quality, so that there are no hazards, it is safe, and it is healthy for them to occupy.
This latest incident at Charlotte Maxeke, coupled with what happened with that structural collapse by the emergency section about 3 or 4 years ago, does it impact on the entire building of the hospital? And will, more need to be done besides fixing the area that was burnt? Will, officials need to go around the entire hospital perhaps because maybe it's affected something else?
And thank you for that question. We have a big project that is currently underway, and this is the Occupational Health and Safety Project that is going to target all 32 hospitals around the province. And at the moment, we have started with the first 10, and out of those 10, 4 have already been awarded. That means contractors are going to be on site as of May. And Charlotte Maxeke, being such a big hospital, is also part of that list. And the work that is going to be done there is major work, including your HVAC, your staircases, everything, the whole works. And this is to ensure that these very old facilities that were built many years ago are brought back to a shape and a state that is occupable for many years to come, especially considering the safety of the patients, the safety of the staff that work at the hospitals, as well as the general public.
All right. Thank you very much for your time. Bongiwe Gumbi, the spokesperson, Gambu, the spokesperson for the Infrastructure Development Department in the province.